Good morning or afternoon, wherever you are in the world. I am Didi Kai, founder of Fit to Profit. I'm super excited to be here with you for the Wellbeing Summit. We get to talk about how to generate profit while creating impact. And with me today is one of my very best and favorite and amazing guest speakers, Dr. Michelle Hurn. She is a registered licensed dietitian with 11 years experience in the clinical acute care, psychiatric and outpatient clinics. While she is in the or practicing in the clinic with the inpatient outpatient care, Michelle discovered really a disheartening connection between carbohydrates, low fat, and the sugar in moderation concept, nutrition guidelines she was required to teach, and rapidly declining health of her patients. And so with that, we have Michelle here today to talk to us more about diets, but not from the standpoint of what you're used to. And I can tell you from my experience with Michelle for the first time, she doesn't really believe in there's a such thing as like a one size fit all cookie cutter type of diet and such like that. So I'm going to have Michelle introduce herself, share with us how she landed where she is and why. Michelle, welcome. And how did you find the work that you do now? What got you into it?
I'll try to. First of all, thank you. Thank you so much for the introduction. And I'll try to give you the Reader's Digest version because, when most people think of a dietitian, they think of kind of their traditional, like you said, those low fat, sugar and moderation guidelines. And we'll talk about like why those may not work for most people. So, my story actually starts back when I was much younger. When I was 12 years old, I had a very serious eating disorder. I was diagnosed with anorexia nervosa at the age of 12. And I was about 5 feet tall and 57 pounds. So I was, went to inpatient hospitalization for 60 days. I was actually, heart was failing, kidneys were shutting down. I was given about a 10% chance to survive, which is a pretty hard thing to hear as a 12-year-old. But anybody who's been through an eating disorder, serious eating disorder, certainly at that time in my life, you're almost glad, you're suffering so much. And so that was actually my first opportunity to work with a dietitian. And, certainly I went from, starvation to having to follow the standard American guidelines. I was fed, the normal high carbohydrate diet. I was put on a 24-hour tube feeding system. And, within several weeks, I had to be put on 7 different medications to manage anxiety, stomach problems, all kinds of things. And, in my book, I'm very hard on our healthcare system, but I am grateful. I did become weight restored and that situation did save my life. But, I was told as a young person, like you're probably going to have this racing anxiety for the rest of your life. I had serious anxiety, had racing thoughts around food. I had, trouble concentrating and focusing, severe body dysmorphia. And I was just told like, hey, this is going to be your lot in life. And so I just kind of decided like, okay, I'm going to have to become a person with an eating disorder, a high functioning person with an eating disorder. And so, I went through high school and college. I got into sports. I became a runner. And, I ended up running in college, but I got a pretty serious stress fracture, had low bone density from the eating disorder. But, I knew nutrition was important and I knew it was powerful. And so I decided like, well, what if I became a dietitian and what if I could help people? And, once I started the dietetic internship, initially, I saw things that didn't really make sense. And I would just ask questions. Like, for example, I would ask my preceptors. We would have patients that were severely diabetic. And, how we traditionally treat patients with diabetes is to put them on these consistent carbohydrate diets and consistently dose them with insulin. So my question was, well, why don't we just remove the carbohydrates? Because diabetes is a disease of carbohydrate intolerance. And I was, oh, no, everybody has to have carbohydrates, and I would see patients with joint pain and inflammation. And same thing, just diets very high in carbohydrates, very high in sugar. Then we would go to the ICU and patients being fed tube feeding formulas. I remember flipping over one of the tube feeding formulas and just being dumbfounded, like, wow, almost, 2 decades later, the tube feeding formulas were the same thing I was being fed as a 12-year-old. were the number one ingredients. If you're in a major car accident or a traumatic accident and you can't eat and you have a tube nasogastrically, the number one ingredients were corn syrup, maltodextrin, soy protein, canola oil, very highly inflammatory things. So I simply posed the question, is this the best way to feed somebody in a traumatic accident? And I was told, like, hey, you know what, that it's fine. It's all calories in, calories out. And so, but you're new. I was a student. I was young. So I became a dietitian, and very quickly, and most healthcare professionals will relate to this. We go into the field because we want to help people. And very quickly, you have this huge patient load. You have minimal time for each person. You have to chart, excessively, in my opinion, for each person. And people weren't getting better. I would see the same patients months later, worse infections, wounds, obesity. But I was told, Michelle, it's not the guidelines of the problem. It's not these high carbohydrate, low fat guidelines. It's the patients aren't compliant. And I just, I didn't see that in my practice. And I brought concerns up to my, to the directors of different departments. Look, I don't feel like I have enough time. I don't feel like what I'm doing is working. And I'll never forget when my clinical director in Colorado told me. She said, well, are you doing your charting? Well, yeah, of course. Are you getting your work done? Well, yes. Okay. It's like, what was communicated to me was it wasn't necessarily the goal to help people. It was kind of the goal to check boxes. And so, but ultimately, it wasn't really until 2019. I was working at a hospital. I live right outside of Portland, Oregon, that I lost my own health. I have been a competitive athlete. I had, qualified for Boston 12 times, and I was trying to qualify for the Olympic trials and the marathon. And so I was training really hard, and I'm, working, and all of a sudden my body just wasn't recovering well. And, most people might be able to relate to this. You suddenly have aches and pains disproportionate to what my running was. Mm-hmm. And so I went to my family doctor, everything checked out fine. Blood tests were fine. My anxiety started to get worse, and she wanted to put me on anxiety medication. And I was like, I don't know about this. And so I talked to a few dietitian friends of mine, and they said, oh, well, maybe you need to eat more sugar and more carbohydrates to help fuel that running. And so I went from eating 350 grams of carbs to up to 500 a day. And as you can imagine, that didn't go particularly well. I'll never forget a run. I literally started cold sweating 2 miles into my run. And kind of the final point for me and the start of my complete health transformation came, I just remember a particularly challenging day at the hospital. I came home early, fell asleep. I think it was early, like around 5 p.m. And I woke up and it just felt like my body was on fire. Like my muscles hurt, my back was aching. And I remember standing in the kitchen, just like, what do I do? Like, I have no answers. Nobody has answers for me other than, well, we're going to have to get you on some strong pain medication. And I didn't want to do that. So at that 2 a.m, I drove to 7-Eleven. I got 30 pounds of ice. I put it in our bathtub. And so by 2:30, I'm sitting in this ice bath crying. And that's when, my wife came in, she had been woken up by the sound, and she was like, maybe we should consider doing something different. And I was like, yes. At that time, I was mentally broken. My anxiety was high. I've talk about in my book, I suffered with depression, suicidal ideation. My body hurt. I wasn't being effective dietitian. I felt like I wasn't being an effective partner. And so I just made peace. At that point I was 36. I said, maybe I'm just not, I can't run anymore. Let's give up running. And that was hard because it's something that, you have this goal and you've been training at that point almost a lifetime, over 20 years. And so since I wasn't going to do that anymore, I said, well, why don't I explore a lower carbohydrate diet? And that's when my entire life changed.
Wow. What a fascinating story. I was hanging on to every word of yours. And so why do you think we have, without really getting into the nitty gritty of it and going down like the rabbit hole with all of it,
sure,
with the information that you have now, how are you working with your clients, and how do you determine what to provide them in terms of advice and where they are on their journey?
Yeah. So, when I first learned of a lower carbohydrate diet, like It's something that in traditional dietetics we're taught almost, it's almost a bad word. Like keto is dangerous and too much fat is bad for your heart. And so, like I said, my health was so poor that I felt like I had nothing to lose. Like I knew what I was doing was not working. And so I always tell people, like, when you nothing changes as nothing changes, right? Like if you're in a spot and things aren't good, it behooves you to explore other options and to ask questions. And, I would encourage anybody, like if you're talking to somebody and they can't answer your questions or they get offended, then you need to move on. Like I never mind somebody asking me, like, why does this work? How does this work? And so when I meet with people now, most people that, reach out to me, health is pretty rough. They're either obese, some people actually struggling with eating disorders. And so what we do is we take like, where are you at? Then I want to teach people. I feel like we've gotten so far away from what humans were designed to eat, to live, to thrive. I do believe all species have species specific diets. For example, I feed my tortoise very differently than I feed my dog. And
Yeah.
humans evolved to eat, in my opinion, to eat meat and fat. It's very bioavailable. The nutrition is, excellent, the vitamins, minerals. And, we can dive more into that if you like. And so normally that's where I start people, that foundation, because most people that come to me are just so inflamed from a lifetime of eating lots of sugar and lots of starch and lots of processed carbohydrates. So my goal is always, how can we stabilize your energy? How can we stabilize your blood sugar? And in doing that, you're also going to stabilize your mind. People are shocked by how much calmer they feel, how much better they feel. That was actually the biggest thing for me. When I first changed how I ate, I transitioned from that super high carbohydrate diet to very low carbohydrate, animal based, lots of meat, lots of fat. And kind of the turning point, within 3 weeks of eating that way, my partner, she asked me, like, can you come sit with me? I said, yeah. And she's like, you know what? I'm not sure if I like this way of eating yet. It was totally different than what we'd been doing. She said, but this is the best your anxiety has been in the 11 years I've known you, in 3 weeks. So it's my hypothesis that many people are not getting the adequate, saturated fats the brain needs, adequate zinc, iron, folate, B12, carnosine, carnitine, all these things that the brain need. We just don't eat very much of. If you think about it, if you go to your grocery store and look at what people are putting in their carts, frozen pizza, bagel bites, cereal, maybe a banana, there's not those really dense foods. Mm-hmm. So yeah, so I like to work with people where they're at. We meet, most of the people I work with, we speak weekly or either every other week. And, I think people are surprised by how quickly progress can be made, and that's one of my favorite things about changing how you eat, specifically transitioning to a lower carbohydrate diet, is it doesn't take long. I was floored when I first started researching this, and this is why I decided to write the book. We have clinical trials that people reverse diabetes in as little as 3 to 4 weeks. I had patients that were diabetic for decades. I watched leg amputations, and it's like, why aren't we talking about this? And I mean, I know why. It's kind of a sad system,
Yeah.
Unfortunately, I can't, we live in a capitalist society. Like I can't heal you or I lose you as a customer, and I can't kill you or I lose you as a customer. I have to keep you perpetually sick and depending on my medications and surgeries. So.
Yeah. Wow. You're speaking to the choir. You're like pulling everything out of my heart and brain, everything that I want to say. So let's switch gears a little bit. I know you have a clinic in Seattle, right?
No.
Or no? Okay.
I did not have a clinic. No.
Okay.
No, I work for a company called Ketogenic Lifestyle Coaching.
Okay.
And so I see patients through that. Yeah.
Okay, that's what I meant. So tell me about like, I guess the process. I know you said results can be seen in like 3-4 weeks. So if people want to find you there and such like that, how would they find you? And then also tell us a little bit about the book.
Yeah, absolutely. So if somebody, if you're watching this and you're just like, oh, I don't know, or you're curious, or you're interested, like I am very, I am very active on email and social media. My, website, thedietitiansdilemma.net. There's a link on how to work with me. Or also you can hit, my contact information, send me an email, I'll get right back to you, or through the ketogeniclifestyle.com that has my profile, that has all the different options to work with me. Because some people, I've had people that want to meet every week, and we can do that. We have people that say, what, I want to teach me. Let's just do a one-time thing. So I like to provide different options for people. So yeah, and I have tons of free information, on my Instagram, different posts and things. So that's probably the best way, either through the website, the ketogenic lifestyle coaching. And I'm usually, I usually try to get back to people in at least a few days, but if I miss you for some reason, hit me up again. Lately, sometimes you get floods of emails. Yeah, the book. So the book is called The Dietitian's Dilemma, because as you can imagine, once I transitioned how I ate, within weeks, I started to feel better. So, but at first I was like, well, I'm not running. Maybe it's just my body feels better because I'm not running. But then my anxiety decreased. And then, that started getting the wheels going. Like, oh my gosh, can this way of eating help other people? And that's when I saw all the research, because so much of our metabolic disease, I mean, most people watching this, our country, the United States, we're a country that is 70% overweight or obese, and only 12% of individuals are metabolically healthy, meaning 88% of us have some type of metabolic dysfunction. And for most Americans, it's either diabetes or prediabetes. And so, I was like, do people know how it's easy? It's not simple. What I mean is, like, when you take out a lot of those processed carbohydrates and you start replacing them with protein and fat, it stabilizes your blood sugar and it completely transforms your health. Sounds simple, sounds easy. Unfortunately, carbohydrates are everywhere. Every occasion, every meal, people can literally be addicted to them, that have those hyperpalatable processed carbohydrates. Yes. So I wanted to write a book where I felt like the evidence was there. I wanted to speak to disease states that I thought could really, a lower carbohydrate way of eating could transform. So I specifically spoke about diabetes, mental illness, including major depression, anxiety, eating disorders, sarcopenia, which is muscle loss. We see a lot of this in our elderly population, and heart disease, because there's so many myths that, oh my gosh, you eat saturated fat, your heart's going to explode. And, if that was true, humans wouldn't exist. We would have made it through evolution. So that, and then I also have a whole chapter on where the guidelines came from, because it's bizarre, and unfortunately has a lot to do with corporate interests. And then I have my story, because, as I started to heal, I started to dream again. Like, could I run? Could I, and at first, first my partner, my wife was like, oh, you can be a recreational runner. Like, you can start enjoying running. Like, we'll just run for fun. And I was like, well, what if I try to run an ultra marathon? So instead of 26 miles, how about I run more than 26 miles? She was less than excited about this idea initially, but yeah, that's just how I felt. Everything in my life changed. And that's my message. And that's kind of my biggest advocacy, is the body and the brain have a tremendous capacity to heal. Like, it's greater than anyone is allowed you to believe, like, truly. Like, most of us think like, oh, we're just always going to have this kind of like baseline of inflammation or this baseline of anxiety. And, once I stopped eating so many things that were harmful to my body and started flooding my body with healthier foods, everything changed. And so I ran my first ultra marathon in November 7th in 2020. It was a 6-hour timed race. So just how far can you run in 6 hours?
Oh.
And I won the race. I covered a little over 44 miles. And then this past November, I entered my first 50-mile race, Tunnel Hill, out in Illinois, and I won that race. And there's a good video of me on Instagram, like, just screaming. It was just like, I was so happy. Like, if you watch the finish, it's like people, there's so much that goes into that, this life struggle and this life journey. And so, yeah, I mean, and I talk a little bit about endurance running in the book, because I do think a lower carbohydrate diet can really benefit endurance athletes.
Oh my goodness. I cannot wait to get my hands on your book. I know we read a bit of it, because I actually am a aspiring triathlete. And
there you go. Yeah.
I used to train for marathons, of course, right before I had my kids. But I was looking at what's my next goal, and how can I really tie it into my lifestyle and with diets and everything holistically. So, oh my goodness, I can't wait now to read the rest.
Good. Yeah, there's a whole chapter on endurance stuff in there. So
fantastic. And so I know that you are so generous with offering our audience a 15-minute discovery call to talk through, just to see if they are a good candidate to work with you. And if they had any questions about what it is that you do, they can find you using the website, right?
Yeah, absolutely. I think that's the best way to find me. So, for your audience, go to the dietitiansdilemma.net and you'll see a cover of the book right there, and just click on contact and send me a message, say, I saw you, I saw your interview, and I would love to talk to you for 15 minutes. I would love to, see if this is good fit. Or for anybody in your audience, if they just have a quick question, like, I'm happy to do that as well. So, just for your just for your listeners, hit me up. We can chat for 15 minutes. We'll do it kind of like we're doing right now via Zoom, to see if it's a good fit, if you'd like to work with me. Or if you just have a few basic questions, or even some, questions about the book or about low carb. Yeah. And if I don't know the answer, I'll see if I can't, point you to somebody who does. I've been really fortunate to work with some really, really intelligent people in the field, Dr. Ken Berry, Chris Palmer, Eric Westman. So one of us will probably be able to help you.
Awesome. Amazing. Thank you so much, Michelle, for your time. If you have any last minute, parting remarks, go for it. And I would love to hear what is the one thing that you want the audience to take away from our conversation today.
Yeah. So I just come back for the one thing for our conversation is just, your body's ability to heal is tremendous. And there's so many people that, if you guys have tried so many different diets or medications and all these different things, and you're still in pain, or you're still anxious, or you're still dealing with depression, or you have a loved one, a brother, a sister, a son, a daughter that is struggling, like, I am here to advocate that this is an option. I think it's unfortunate as health professionals, we don't present the low carbohydrate diet as an option to treat these diseases. And if you're skeptical, please look at my book, please reach out to me, because there is science behind it. And I think as the years go on, there will be more science. So that's my one message, is be open, ask questions. And, the only other thing I would kind of talk that I like to throw out there, that it really doesn't have anything to do with nutrition, but one thing that I recommend just for health in general is something that I'm personally working on, but I'm just calling it being radically present. I feel like as a society, we're just so busy that we often, when we want to change, we fear the past. Well, this hasn't worked. Well, this hasn't worked. Or, well, what's that going to look like the future? What if it doesn't work? Where it's like, just be here, show up, be brave, take risk, and just kind of be present. Because when you're kind of stuck worrying about what happened or what might happen, you miss the potential to really move forward and make sustainable change.
Oh my goodness, I love it. So resonated with me. What you just said was basically, what if you choose to be present for yourself and really start your health and wellness journey on a blank canvas?
Mm-hmm. And you can. That's exciting. And it's like, the more people I've met, and that's another kind of cool thing about the book, is there's 25 testimonies. You're never too far gone. Like, it doesn't matter if you're 8 or 80 or 100, or if your health is completely trash, or if you're just kind of like, it doesn't matter. Like, your ability to change, like, you can start right now. It's cool. There is hope, and there is healing.
Hope and healing. Thank you so much for your time. You're an array of sunshine. I love your energy. I love how articulate you are with sharing what's really true and your experience, and just really standing by that. So thank you so much. It's been an honor to have you on the show, and continue doing what you're doing. Thank you so much. I'm going to say thank you on behalf of your clients that you worked with, the current clients and the future clients, because we need more advocates like you out there. Thank you.
You're so welcome. Thanks for having me on.
Awesome.